Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon, and I am addressing the RNA series number 24. RNA is nothing but random questions in neurology and neurosurgery with answers given by me, Dr. Gireesh. This is to benefit the practitioners of neuroscience, neurologists and neurosurgeons, as well as in the medical field for a lifelong learning and also for public awareness. In this series, I am addressing this important question: what are the features of syndromic craniosynostosis? The syndromic craniosynostosis, the one is Crouzon syndrome. Syndrome is nothing but a constellation of groups of symptoms. Crouzon syndrome was described by Octave Crouzon, who is a French physician. He described the syndrome, autosomal dominant, in a mother and a daughter in 1912. And these features are associated with bilateral coronal craniosynostosis, midfacial abnormalities, forward protrusion of the eyes, and airway obstruction. About 30% of the patients will have fluid built up in the brain, hydrocephalus. Generally, there are no limb abnormalities. Intelligence is often normal. This syndrome occurs in 1 out of 25,000 births. A mutation that may be responsible for the Crouzon syndrome has been found in the FGFR2 gene of chromosome number 10, that is fibroblast growth factor receptor 2 gene. However, up to 1/3 of cases this occurs spontaneously. So, this was described by Octave Crouzon, a French physician in 1912. The next one is the other syndrome is Carpenter's syndrome. This syndrome is commonly associated with lambdoid and the sagittal synostosis. The child may also have limb abnormalities that may include an extra digit on the feet, or it can be fusion of the feet as such, 1 or 2. It is also associated with abnormalities of the heart. A genetic location has been identified in 2 genes, RAB23 and MEGF8. This syndrome was again described by George Alfred Carpenter, an English physician and pediatrician, in 1909. This is also termed as the type 3 acrocephalopolysydactyly. So that's indeed the features of Carpenter's syndrome. The other one is Pfeiffer's syndrome. This syndrome is also characterized by craniosynostosis and limb abnormalities. This was described by Dr. Rudolf Arthur Pfeiffer in 1964. He was a German genetist. Unicoronal craniosynostosis is common, as well as midfacial abnormalities, protruding eyes and hearing loss. Fluid built up in the brain is common. There 3 types have been described. The types 2 and 3 are being the most severe form. And so that is very brief, the features of Pfeiffer syndrome described by Dr. Rudolf Arthur Pfeiffer in 1964. And the other syndrome is Seither-Schwartzen syndrome. This Seither-Schwartzen syndrome, this is a congenital syndrome that is often associated with craniosynostosis and limb abnormalities. The genetic location of this syndrome is a little different than the other syndromes. The characteristic features include coronal synostosis. Usually it will be unilateral with limited growth of the anterior cranial base. Children may also have a lozed hairline, eyelid abnormalities, facial asymmetry, and mild to moderate developmental delay. So this was described by Håkon Sætre, a Norwegian psychiatrist, in 1931 in a mother and 2 daughters. And also simultaneously in 1932, this was described by F. Schouten, a German psychiatrist, and he described in a father and two sons. Both of them have described it independently and they were not known to each other. And of course, this syndrome came about because they had similarities of presentation. So, these are the features. So, these are some of the most important of those syndromic craniosynostosis. There are few others too. Sometimes in syndromic craniosynostosis is always sometimes associated with a genetic condition. It can also occur spontaneously. The conditions which I have described are the Crouzon syndrome, Apert syndrome, Carpenter syndrome, Pfeiffer syndrome, and Sartre-Johnson syndrome. That's indeed the features of syndromic craniosynostosis. Thank you very much.